Our next guest is a nurse and works with bariatric patients on a regular basis, but when she set out on her own personal weight loss journey, she did not opt for surgery. This is a picture of Tracy Norton before she lost weight with Medical Weight Loss Centers. And now, here she is today, 70 pounds lighter, and you look incredible. Do a little spin for us. How terrific. Congratulations. And she's joined by Andrew Rodigan, the owner and Associate Medical Director of Medical Weight Loss Centers. Welcome to the show, both of you. Nice to have you here.
Thank you.
So, Tracy, what do you think? Has this changed your life?
It absolutely has. I feel so much better. I'm living life again, getting out, seeing people that I haven't seen in a long time. I feel really good.
Tracy, what was the deciding factor where you said enough is enough?
I just felt like I wasn't living life. I was, not spending as much time with my kids because I didn't want to leave the house. I didn't want to see family I hadn't seen in a long time. So it was time. I didn't want to live like that anymore.
Got it. Now, Andy, what was Tracy like? What were her stats before she started?
When Tracy started, she was in the severe obesity range on the BMI chart, but she also had what 87 million other Americans have, pre-diabetes. She had high insulin levels. Insulin is the fat-storing hormone. We were able to detect that on some lab work, help fix that, and combined with her following the diet and doing really well in the diet, just transformed her life.
Got it. Now, Tracy, you work with medical weight loss all of the time, but you chose not to do that. How come?
I didn't want to have surgery. It wasn't for me, the recovery time. Not that there was anything wrong with that. Many people do it, but this is what fit me better, I believed, and it worked.
All right. Now, how did you approach the weight loss mentally? I'm sure you had to prepare for this.
Like I said, I just had enough. I didn't want to be overweight anymore, and I knew that this was it, and this was, what I had to do.
All right. Now, Andy, tell us some advice for people that might be interested in this type of procedure.
Well, again, Tracy...
Well, not really a procedure at all. It's more of a diet?
It's not, exactly. Okay. So Tracy works in bariatric surgery, where they cut and... we work in the medical aspect of bariatric medicine. It's like cardiac surgery and cardiology. Cardiology is the medical treatment of the heart. So we do medical weight loss, and obesity is a chronic medical illness. And if you are not able to do the lab work and find out what the metabolic issues are, you're never going to treat this disease.
Okay, so this is no surgery involved.
No surgery.
And yet drastic results.
Exactly.
Now, would you recommend this to people who might want to lose some pounds?
I absolutely would. It was pretty easy. As long as you followed what you were supposed to do with the proteins, and it worked.
Now, you mentioned you started this in October.
Yes.
So this is less than a year you've lost 70 pounds.
Yes.
Talk to me about how you maintain this.
The same way you lose it, just high protein, minimal carbs, exercise, getting out with the kids, running around. So, it helps.
And what has been the reaction? I mean, have you seen people that you haven't seen in years?
Yes, and people walk by me that I have seen, and I started to think people didn't like me anymore, and it comes to find out a lot of people said, we didn't even know it was you. They didn't recognize me, so.
Wow. Andy, tell me what's going to happen when someone steps foot in your office. What are the first steps to doing this?
Well, the first steps are we take a very thorough history and physical examination. We look at all the medications you may be on. A lot of medications cause weight gain. And we look at your labs, most importantly, to see if there are any metabolic issues you have, like Tracy, with insulin resistance. And again, if your insulin levels are high, you will never lose the weight. You might, the symptoms may go away, the body fat, but if you don't treat the underlying problem, the symptoms will always come back. So we have to treat the underlying illness, and obesity is a chronic medical illness. And it is treatable. It's very simple, but it's not easy. It's a very simple protocol.
Now, tell me who would benefit from this program?
Anyone who is either overweight with some what we call comorbidities, if you have high blood pressure, diabetes, high cholesterol, or certainly anyone whose BMI is above 30 or in the obesity range would benefit. Obesity is the #1 preventable killer in the United States right now. So it's the driver for most medical problems that we face as a society.
Okay. Tracy, give us some advice to those who want to drop the weight.
Give it a try. It works. Really. I have nothing negative to say. Yes, it is work. It is work, and you have to follow. But well worth it. Well worth it.
All right. That sounds terrific. Now, Andy, where are you located?
We are on East Haven, on Foxen Road, 836 Foxen Road, Medical Weight Loss Centers.
All right, all the information is on your screen. If you want to get in touch with Andy at Medical Weight Loss Centers, you can call 203-468-9220 or online at medweightlosscenters.com. I want to thank you both for being here, and congratulations, Tracy. Enjoy the summer bikini season.
Maybe.